But today is W for Wednesday, W for Women Health, and we are back with our uh, second session on miscarriages and PCOS. We discussed about miscarriages last time, and today we are going to speak about how they can be prevented. So very happy to have Dr. Girija Wagh with us again today. We'll give you a quick prelude about True Wealth as our platform. But before that, of course, you know that we are running this women clinic. Right now, of course, we are running it online so that patients can reach us with their issues, both for the medical treatment as well as nutrition and fitness advice online. So we do take care of the entire medical health, nutrition, lifestyle under this clinic. And True Wealth is an integrative healthcare initiative guiding patients and healthy individuals to overcome their health concerns and manage self-health to reach the ultimate goal of holistic health and happiness. True Wealth aims to help you separate science from hype by sharing authentic knowledge and wisdom from healthcare and nutrition stalwarts so you can make the right health and nutrition choices. It, of course, also desires to unleash the therapeutic role and potential of nutrition in curing and preventing diseases of today, which even modern medicine is unable to partly or completely treat. True World's ultimate goal is to provide integrative and personalized health and nutrition advice to achieve health and happiness. A quick note, of course, before I introduce today's speaker, is that this live program is organized only to give you more information and guidance, authentic information to give you guidance to keep your health, nutrition, and fitness during this pandemic season and otherwise as well. But however, understand that the recommendations made by the speaker and the other participants cannot be treated as consultation. For personalized consultation, you can reach us on 982-0048369 or visit our website www.truewealth.in. To ask questions as well, you can call us on 982-0048369. Right now, we are live with you. You can also type in your comments into the Facebook Live comment box where you can ask us your questions. And I'm sure we will do more than justice to all your questions and concerns. However, again, note that this program is not intended to provide any information on COVID-19 and related treatment. You can approach the hospitals and doctors assigned by the authorities to get the right information. On that note, I would like to introduce our expert speaker who is with us today. That is Dr. Girija Wagh. Of course, Dr. Girija Wagh is Dr. Girija Wagh, of course, has 3 decades of experience. Okay, my slides are giving me a tough time to. Bear with me for a second again. So, Dr. Girija Wagh has 3 decades of experience, especially in normal and high-risk obstetrics and gynecology, IVF, fertility treatment, diet control, PCOS, procedures of fertility promoting laparoscopic and hysteroscopy surgeries. She's, of course, MBBS. She has an MD in obstetrics and gynecology from the BJ Medical College and Sassoon General Hospital. She has a diploma in advanced gynecological endoscopy from Germany. She's a fellow of the Indian College of Obstetrics and Gynecology and also a fellow of the Indian College of Surgeons. She consults at Cloud9 Apollo Hospitals. She's a consultant and professor at the Bharti Hospital in Pune and runs her own setup as well. She is the chairman. She's been the chairman of the Medical Disorders Committee at POXI. She very actively works with this association, which is one of the topmost associations in obstetrics and gynecology in the country. And Dr. Wag has, of course, spoken at multiple different conferences and programs, and she's also a staunch feminist and believes in empowering women health, empowering women through health. Having said that, I would really pass on the baton to her to actually speak about the miscarriages and their prevention while women actually have an underlying PCOS. So, madam, really over to you.
Okay, can you see my slides now? Hello? Hello?
Yes, I think your slides are visible, ma'am.
Okay, thank you so much. So, thank you, Rajeshri, as always, for being so nice and kind and, setting the stage right for our viewers. And I must tell you certain feedbacks from many of my own students, patients, and they really enjoy our sessions. And I think this gives us a huge inspiration to keep on going with what we are doing. And we have always decided that we are determined to eradicate PCOS completely from the lifetimes of our women. And today, with increasing, I think, connection to the web-based knowledge source, and then we getting onto this kind of a medium, I think the knowledge is really, really improving. We are, like never before, being able to reach out to people. Probably we were not able to do this from our small little clinics and small practices, but today we can reach out to more people, and I think we should make most of the situation finally.
Yes, absolutely.
It's our responsibility that we create a healthy human future race. And as you and I are committed to this particular melody and this particular responsibility, we continue our second part of discussing PCOS with miscarriages. Now, last time we saw that PCOS really, really has a whole lot of problems associated with it. Some of them we are going to brush in this session, but most of this session is going to be trying to make all our viewers understand what is the essentiality of certain things that we advise to you. And of course, at the end of my talk, as always, Rajshri is going to tell us about various things that require to be as nutritional correction is essential. Before I move on to my actual talk, I would like to wish you all a very happy Janmashtami and look at this very serene picture of Lord Krishna, the epitome of a lot of achievement, silence, peace, and enigma. And I think we all should be, sort of reaching out in spirit to this particular deity of Krishna and bow down and pray for a lot of humility, peace, health, and of positive surrounding, and maybe the world, as Rajshri and I am determined, free of PCOS. So that's how we move on. And as I was telling you last time, that there has been a doubt, because sometimes whenever we go and analyze the relationship between miscarriage and PCOS, when you really decide to go and look into studies, it's been found that there are many confounding factors which are responsible for this kind of a presentation. So if you look at normal things that happen in your ovary, these are little scientific terminologies here, but nevertheless, now I'm sure my viewers are becoming smarter as they're trading with me and understanding a lot of things. That whenever this is the part, a cut section of the ovary of a normal ovary where there is no PCOD, and you can see the follicular genesis, which is a process by which the eggs are forming from the ovary and going through various stages. There are various kinds of vascular things that are happening. Blood supply coming to the ovary, the changes that are occurring in the basic structure of the ovary. And this is how a normal ovary looks into perfect harmony. While if you go back into a ovary, which is a polycystic ovarian syndrome ovary, you will find that there is a lot of disturbance in the ovary itself. So what happens is this egg forming procedure itself is either defective or it is deficient and it is not optimum. And therefore, even if the egg is formed and the pregnancy is achieved, the ovary is not able to make hormones which are going to help in sustenance of that pregnancy. And therefore, that is labeled as a miscarriage, where a pregnancy happened, but it did not move to viability. And this basic association is a dysfunction in the ovulation itself. So the very basic core foundation of pregnancy itself is affected, as we can see in PCOD. And therefore, getting underway a pregnancy first, and then getting away a sustenance of pregnancy is the second challenge that we have in PCOS. Now, the reasons have been studied, and they have found that there is one particular hormone by the name of luteinizing hormone, the LH, which we typically call as, and this particular hormone causes increased secretion of a pregnancy supportive hormone, which is called as progesterone, but it happens very early or not in the right level, and therefore that pregnancy does not see the light of the day. And therefore, you must be seeing that whenever the doctor calls you for checkup or you come for checkup, sometimes even if you have done this test maybe 6 months, 8 months ahead of the time, you will be still told to do these hormones, these changes, because finally, whether you are going to have these hormonal changes having an interplay into causing miscarriages can be determined only by looking at levels. Many times, if women have taken efforts to lose weight, then the doctor may not suggest looking at these hormones. But if you have not lost weight, you are still having menstrual irregularities, and you are wanting to get pregnant, then unless and until you look at these luteinizing hormone levels, it is very difficult to plan any treatment for you. So, therefore, the blood tests which are advised to you on the second day of your menstrual cycle are very important for the doctor to make judgment. Even if before starting, let's say you decide to go in for artificial reproductive technology where we are purposefully going to stimulate your ovaries, even in such a situation, it is important that we look at these basic hormone levels, and that is why you have to understand. Likewise, you are ordered to take tests of insulin and glucose because they tell us, so that acts as a documentary evidence of what is actually happening in your metabolism. And we have understood that insulin resistance and late ovulation, that is after day 16 of the menstrual cycle, also may reduce the quality of egg, which can lead to miscarriages. So, ovulation not occurring optimally, and therefore lining of the uterus not forming well. And because of all these other extraneous changes of insulin resistance and abnormalities, miscarriages happen. Now, the incidence, if you look at the statistics, how much is the quantum of the problem? So, PCOS is known to increase your risk of having a miscarriage with rates reported to be as high as 30 to 50%. Can you imagine? It is so very high. And if you have PCOS and are undergoing assisted reproductive therapy, such as IVF pregnancy or intrauterine insemination, then you are 2 times more likely to have a miscarriage. And therefore we will, whenever we are giving you treatment, we are also trying to look at your risk of miscarriages. Now, the other way also is that it is important, if you want to have these miscarriages, the best way to prevent is in women with PCOS is to normalize these hormone levels to improve ovulation and normalize blood glucose and androgen levels. Now, having said that, if you want to normalize your gonadotropins, that is luteinizing hormone or FSH, the only way in which it can be brought out externally by medicines is by giving you contraceptive pills. Now, these combination pills, as you know, when you take them, you're not going to get pregnant. So many times the doctor, before he plans your pregnancy or she plans your pregnancy, they decide to first stabilize your cycle. But mind you, while this cycle is being stabilized by these pills, you are still, that is not going to make you pregnant, one. And secondly, your responsibility also is to use that window of opportunity to stabilize the rest of the factors, because the pills are going to take care and responsibility of only stabilizing your hormones. The moment your hormone stabilization treatment is stopped, you must be able to ovulate and get pregnant and carry that pregnancy forward. So therefore, many times whenever a pregnancy doesn't sustain, the doctor will say that let's take a breather for a while. Let's first stabilize you. And this stabilization, you have to remember, is brought about by hormones which won't make you pregnant. And therefore, it's always better to have a continuous effort towards maintaining your healthy lifestyle. Because if you look at the PCOS and miscarriages, it's sure you are heard, my dear Rajshri. You need to mute yourself because whatever you said now, we could hear it. So there's a nexus between the polycystic ovarian syndrome and the miscarriages. And why am I saying that? Now, if you haven't been priorly diagnosed with PCOS, but you have had multiple early pregnancy losses, or you have become pregnant and then you lost that pregnancy, or there have been many miscarriages, please go back and evaluate yourself for PCOS, because PCOS can be one of the most important underlying factors, the commonest ones, especially in the Indian setting, because there has been a study which found that PCOS was present in approximately 40 to 80% of women with recurrent miscarriages. So, therefore, if you have already had miscarriages, go back, analyze. Am I having PCOS or any other disorder? And your doctor will definitely advise you to go undergo these particular tests. Now, many times patients do call us, come back and say, Doctor, I am pregnant, and they're very happy. And what happens is they have done this pregnancy test, it comes positive, but then when you schedule a sonography checkup for them after a week's or time or so, around 5 to 6 weeks of conception or amenorrhea, we find that there is no pregnancy. And if you just go and do a pregnancy test, it will come negative. Now, this is typically what is called as a chemical pregnancy or a false positive pregnancy test. We have to remember that a clinically confirmed pregnancy is the only one in which you can actually see the baby on sonography and the cardiac activity of the baby. And usually on ultrasound, you're able to find this cardiac activity by the time you are 6 weeks pregnant. And it is best seen by a transvaginal scan. I am seeing that many women have a lot of reservations of an internal sonographic checkup. Believe me, friends, with obesity, with lower pelvic abdominal fat, abdominal sonography may not be able to give you the details that can be possible on a transvaginal sonography. And therefore, for your own better diagnosis and identifying these changes much better, you must opt and cooperate for a transvaginal sonography if the doctor is offering you one, and that will help you in confirming pregnancy. So, chemical pregnancy can be just a hormonal change which has been tacked onto your pregnancy test, while it is actually not a pregnancy. So when we look at this particular hormone, which is the hormone tested in the pregnancy test, it's an HCG hormone. I hope we are live, Rajshri.
Yes, ma'am, we are live.
Okay. So you can see that HCG levels here are the hormones, or the typical hormone, which is called as the pregnancy hormone, which is secreted by the pregnancy cells. And these cells keep on secreting the hormones. And if you look at the line from the time of the period of amenorrhea, that you find that it will slightly keep on rising, and then you will find that it is doubling over a period of time, and then you will find that the HCG levels rise. While you can see here in the red line here, the HCG levels are not rising satisfactorily, as they should double nearly at least every 72 hours. And this can be a pathological sign or a laboratory sign of a miscarriage. Sometimes this HCG also worries the doctor whether this pregnancy is growing inside the fallopian tubes. And that is the reason why we have to be careful. And this is how you can see in this diagram here that before the pregnancy happens, this is what is just before the embryo implantation and all is happening, you can see that the HCG is rising. And then later on, it would suddenly drop. Your urine pregnancy test has come positive primarily, and then it becomes negative because that particular implantation either did not occur well, or maybe it got lost because it could not sustain or could not get stuck to the mother's womb because of various hostile changes that are there in the endometrium because of the underlying PCOS condition. And for this reason, it is important that we are careful. So you'll find that whenever the doctor does your pregnancy test, he says, no, first let's also confirm by doing your blood test levels of HCG. And the doctor may also insist that let's do a sonography at a particular time. And once we see the fetal cardiac activity on a sonography, we will be confirmed that yes, the pregnancy is happening viable and is having a possibility of growing further. Now I'm going back to a little bit of a recap that we had in the last time as to why will these losses occur. This happens either one because of poor controlled diabetes. Now we know that HbA1c, the glycosylated hemoglobin, tells us about blood sugar for the past 3 months. And whenever this HbA1c level is more than 5.4, there are possibilities of miscarriages. And therefore, when your doctor tells you to do this test and it's not been nearly over 6 months, please do it because it will tell you whether what are your possibilities of miscarrying. And we all know that PCOD has something like a pre-diabetic association, or some PCOS can have even frank diabetes. And controlling the sugars, blood sugars, is going to go a long way in trying to prevent miscarriages. And that's something which is doable either by lifestyle change or by medicines. Another contender to cause this problem is the thyroid disease. And thyroid disease also today has been identified to be a lifestyle disease. It occurs because of nutritional changes, it occurs because of stress, it occurs because of so many environmental factors, sedentary life, genetic predisposition, everything is similar to diabetes. And thyroid disease, especially when there are increased thyroid antibodies in your blood, there are possibilities of not only not getting pregnant, but there can be also miscarriages. I had this woman who was coming to me after her 2 pregnancies and she wanted to become pregnant the third time, and she was going around a whole lot of treatments for the same. Before she came to me, she had undergone 3 miscarriages. Just imagine 2 normal babies, then she had 3 miscarriages, and she just couldn't believe that she has a problem. I said, let's look at your thyroid antibodies, and they came abnormal. The moment we treated her, she conceived within 2 months without any aid, natural conception. So this can also be a cause. Hyperprolactinemia associated with huge amount of stress. The moment you do this hyperprolactinemia, many times it's very high, then it can be a tumor in the brain. But most often it is because of excessive secretion from the hypothalamus because of stress. So improper sleep, improper lifestyle gives rise to hyperprolactinemia. Many times the stress of not conceiving, the stress of losing many babies can also give rise to these disorders. And these are all associated in PCOS and can be definitely modifiable. And then if you look at the PCOS criteria, this is a typical sonographic criteria you're well aware of. We have been talking about it, but if you're not, we are there as doctors to treat it for you, to identify you and diagnose it and categorize you. So another very important factor, so if you look at all these endocrine factors, you would agree with me that these can be just modified by nutritional modifications. Let us look at this picture very, very carefully. You can see that this picture is depicting a wonderful balance of various kind of foods. And these foods are not only so conducive to help you to stabilize your hormones, but to improve your moods. It will also help you to give a huge detox or an antioxidant kind of an effect. And these are a wonderful combination of complex carbohydrates that you can see, which will not give you a sudden rise in sugar. It is a combination of those berries, which are known to be very rich in their nutritional value and to help in modifying all the wrong things that are happening in your metabolism in your body. You can see that it is containing foods like kiwi, Now, these are very rich in vitamin C and folates, which are essential when your pregnancy is forming and for your baby's growth and sustenance. And it also contains milk, or it may be having a buttermilk or a whole milk. And this milk is going to be a good source of calcium, proteins, and so many other factors. Now, if you look at this particular type of a food intake, if we take, and Rajshri is going to give us much more details about it, we have to have this as a sustained effect, because this is not only going to help us to conceive, help us to correct all the wrong disturbed metabolism in the body, but it's also going to help us sustain the pregnancy. And therefore, nutrition has an important role. I can see that many patients expect their doctors to give them charts. See, we are very, very educated and highly learned people. We all know why and what is going wrong with us. I have had hordes of patients who will take all this diet on one side, and then every meal they will be having a fried papad or a fried stuff along with that. That's not going to help. So we have to be extremely strict about diet, what is actually going through our mouth, whether it is going to be really, really useful for all the mechanisms of my body when I'm trying to make my babies, and whether it's going to help me and my formation of the baby. PCOS also has a very, very uncanny sort of association. And unfortunately, there are a huge lot of eating disorders which are found in PCOS. Now, you can see here an obviously obese child or a woman sitting here who has PCOS, and a typical this kind of a structure, bodily structure is associated. But believe me, even lean PCOSs have these problems. And the terrible part about lean PCOS is, unfortunately, the diagnosis can elude you because they are lean. Then many times the doctor may think it's not PCOD. But PCOS patients also have huge amount of insulin resistance. They have a risk of diabetes. They have nutritional challenges, and they are also not properly balancing their diet. So one of the reasons what will happen for PCOD commonly seen is negative body image. Because of obesity, we are always frustrated. They are fatigued because they are not doing any physical activity. They have to carry such a load of fat all the time. The body, the muscle, the mind, the emotions, the psyche, everything is fatigued. There is constant weight gain. I have had so many patients coming to me with this disease. The moment you plan their pregnancy and tell them, now you're not going to put on weight, let's go ahead, we are planning pregnancy, these are your things, these are your analyses, this is how you have to go. They come down 6 months down the line and they say, and they are weighing 10 kgs more on the weighing scale. We need to find out what is the problem. And we have to be, as you expect your doctor to be dedicated to your health, even you require to cooperate to the doctor to help this. Even the negative metabolism parameters cause depression. Additionally, there can be diseases like endometriosis. There can be back pain because there's no strength in the muscles, and there can be huge lot of menstrual symptoms. Sometimes the doctor will cajole you, will tell you everything nicely, but sometimes the doctor may even scold you, but you will have to understand that this all is happening in your own interest. And you have to be determined to be able to achieve the results that we are looking for. Because having babies and carrying them forward is such a wonderful thing. So there has to be a balance of diet, which actually is proper nutrition, with a whole lot of fruits, salads, and vegetables. Weight has to be a constant thing, because having said that, we know that weight is not always what matters. What is actually the composition of your body matters, but weight is something which is easily measurable and you can help to identify. There has to be a proper balance between your psyche, your work, your physical exercise. Too much of active exercise is also not right. Too much of sedentary lifestyle is also not right, because if you don't move, how are the bodily functions going to function? How is the blood supply going to reach to your endometrial lining to get you pregnant? So these things are important. And exercises, I always believe that yes, it is important to have aerobic exercises because they improve the strength of your heart and the muscles and improve your respiration and oxygenation. But I also am a staunch believer of yogasana, And you can see this wonderful pose of one of the yogic poses that you can see. This helps in actually squeezing your pelvis in such a way that it will help in improving the blood supply to your pelvic organs, which will help in improvising the function of your ovary. So it's important, and these are the organs which are actually going to come in play when you're going to have children, and therefore you have to identify. Whenever I ask my patients what exercise, yes doctor, I'm doing my exercise. What are you doing? I'm walking. Most of them will be walking. Please believe, friends. Walking will just warm up your body. Walking is not going to help you to stabilize your insulin resistance or to, normalize your abnormal metabolism, which is associated with PCOD. So your exercise also has to be a proper balance of aerobic exercises, muscle strengthening exercises, yoga, where at the end of it you must feel peaceful, happy, and nourished. And that is very important. And the drug which is very commonly given by us in practice is actually a metformin. Now, metformin I am purposefully mentioning here because this is a drug which has come and gone through practice many a times. And it has been identified that this effectively is known to reduce the insulin resistance. What is very important is it is also, there is a fear in the minds of women that if you are using metformin and then if you conceive, are you going to have any problems in your baby? And there have been now lot of studies which have shown that women who are already taking metformin for PCOD treatment continue them throughout the entire pregnancy. In the first half of the pregnancy, it supports the embryo to retain inside and have viability. And in the later part of the pregnancy, it will help you in preventing abnormalities such as gestational diabetes mellitus and blood pressure abnormalities. So therefore, it is very important that this metformin, if we have already started, has to be continued during pregnancy, or maybe the doctor may start anew when you're planning to get pregnant, so that it ensures that it will sustain your pregnancy. And believe me, there are evidences now which are saying that it does not have any effects on embryos and it doesn't affect the pregnancy outcome or cause any abnormalities in the babies. But we are speaking about early miscarriages being very common in PCOS. But believe me, PCOS women are also at risk of second trimester miscarriages. The baby will grow further, but then these women, if they do not continue their lifestyle change during pregnancy and the medication that the doctor is telling, there can be placental problems giving rise to hypertension disorders or fetal growth restriction. Women can be more susceptible to infections, especially genital or urinary infections. If when you become pregnant, all your hormones and HbA1c is not stabilized, your babies may be born with congenital abnormalities. You can see in this picture a cleft lip in this baby. And therefore, it is important that you stabilize your health before you embark on pregnancy. And therefore, miscarriages usually are decisions taken by the universe. Let's not continue this pregnancy because it's not going to be healthy to continue it further. Then poorly controlled chronic conditions like hypothyroidism, diabetes, blood pressure, anemia, these can also give rise to miscarriages. And of course, cervical insufficiency in all these. And if you have any vices in association, which you have decided, abhi main pregnant ho gayi, main kuch bhi karungi, please remember, friends, that whatever changes you are embarked upon before you became pregnant, they have to be sustained and continued to ensure that the pregnancy continues healthily and does not land up in miscarriage. I think that ends my talk. Thank you so much for a very patient hearing. And I again end my talk by wishing you all a very, very happy Janmashtami and a lot of prosperity in health, wealth, and mindfulness. Thank you so much.
That was fabulous, ma'am. A completely holistic talk from your end. And I think, as we all know, this is one of the most critical issues that women face. And, no matter how much other issues that we face, this one's always the most hurtful and most emotional, as we call it. So I am actually I don't know why, but today I've been having some issues with my PowerPoint, but my slides are still very much back here. So I'm just going to, I apologize for, those small issues that happened. But what I have observed is that, up to half, and the data also says that up to half or more of pregnancies actually are very unplanned, which means women are most times unprepared to have a healthy pregnancy, and that is, I think, most critical when we are talking about
75%, Rajesh.
yes. That's the data, and we would think that this is probably the most important important celebrating moment in our life, but we are most unprepared for it. So what we really, that's why I need to do, and actually balancing hormones naturally is something important. So we first need to get ourselves really prepared in terms of, as ma'am said, completely, in terms of treatment, nutrition, fitness. She also said mindfulness. That's really what we need to be prepared with. Basically trying to make lifestyle changes or lifestyle maintenance, whatever we say. If we have a healthy lifestyle, we can improvise it better. But having a healthy diet, a regular exercise, wholesome habits, again, getting good amount of sleep, hydration, all of these are very important. And then, of course, if we are suggested specific nutritional supplements, so it is important for you to visit your doctor also, accordingly, a nutrition expert who's working with the doctor hand in glove, and if then any kind of supplements that need to be given. But otherwise, I would actually now first go on to the diet, which I keep reiterating that we need to have a balanced nutrition. But the balanced nutrition has to be with a lot of positive feeling about all this. So if there are other things bothering us along with it, you need to take care of them. We do not realize, but a good mental health and a good gut health, along with a good fitness, is extremely essential when it comes to conceiving and not facing a miscarriage. It is critical, as ma'am also mentioned, that a normal BMI is really, really critical for our regular cycles to keep PCOS under control. And basically, we need to focus on losing weight, building bone and muscle, keeping energy, and making sure that our cells get good recovery from all the smaller damages, because we are preparing ourselves for not just ourselves for a good health, but also for the baby now, so that we will be able to nurture the baby throughout for the 9 months and later well. So this is extremely important from a preparation standpoint, and I think that really plays a major role is in also avoiding, preventing any sort of issues that we're going through our pregnancies, because also a miscarriage can happen in the later trimesters and not just the first. So the important, as I always reiterate, is also the quality of protein. So here we did speak about how much protein, and I would advise at least a 40% protein intake or more, that if we can take, that will really help us in recovering our cells and building the bone and muscle strength, because muscles becomes a bigger issue later. So we need to make sure that we have all this in place. Eat carbs and eat good fats, but proteins, make sure you're eating varied protein from all different mediums, like it should be dairy, it should be whole grains, it has to be beans, it has to be vegetables. And I have put some of these vegetables which are higher on content of protein for your reference. However, we have to really make sure with a good pre-planned diet, nutrition, so that it can help you prepare for your pregnancy as well. A lot of times, vitamin mineral deficiencies are so common these days, especially now. If someone is planning for one now, we will be so many of them will actually have vitamin D and B12 deficiencies, and these are important vitamins when it comes to what we call as prenatal vitamins. All that falls under that. So we have to make sure that we correct these vitamin mineral deficiencies. And of course, gut health is extremely important. We have to make sure that our nutrient status has to be in place when we are actually preparing for a pregnancy, especially if we have gone through a miscarriage earlier, or if we have the fear of having one, because if we are overweight, if we have other comorbidities like diabetes, or if our BMI is on the higher side with obesity, then in those cases, the nutrient status plays a very critical role in preventing miscarriages, is my observation and study, a scientific study out of it. And enzymes are extremely important when it comes to uptaking all these essential nutrients. So you may eat all the good foods, but they won't get digested. Also, through pregnancy, constipation is a very common issue. So if we are able to keep our digestion well from the beginning, it's also going to help us through the pregnancy completely. So make sure our digestion is good. And also what ma'am was mentioning, mindfulness. For that, the gut-brain axis is something which we need to understand. And what that is, that, if your gut is going to have some very good balance of good and bad bacteria, so your good bacteria are higher in number, then it'll actually help balance this gut-brain axis, and it will have all the good influence in terms of mood, behavior, stress, anxiety. Uh, it is a known fact that the neurotransmitters, the gut has more neurotransmitters than the brain. So to make sure that we can stay happy is also important. So because the brain influences the gut and the gut influences the brain. So both which ways of balance has to be there. So understand that eating right foods, consuming good amount of probiotics, yogurts is also essential through actually preventing the miscarriages. And again, like I reiterate, you should have a good mix of multivitamins, minerals, but with electrolytes and antioxidants. And I'll quickly explain to you why. So it's important that we stay hydrated. Good amount of water needs to be had, and if it is not had, it can actually add to the oxidation and inflammatory process. And the cell health is extremely important. At the ground cellular level, we need to understand hydration is very, very important. These are two very notorious things which in my not just the scientific papers that we study and the experiences that we get, but this is also a gut feeling that I have, a strong gut feeling that oxidative stress and chronic inflammation are underlying major causes, and the most dangerous, ununderstood. They always come together. This is a major concern in even today's immunity that we are trying to build, and we are seeing even through COVID, patients are dying because inflammation and oxidative stress coexist together. This is what it actually does to our body cells. And just as what it does to the apples, it's doing to our cells. This is very important for women to focus on, because this is an underlying cause which is ununderstood. It affects every organ of our body. It affects the immune system, to hormones, to almost every organ and every cell in our body, which is why, and if that is then clubbed with depression and anxiety, which we normally go through when we are conceiving for the first time, or if you have gone through a miscarriage earlier, then that can actually worsen the situation. It is very, very important to bring down inflammation before you actually prepare, while you're preparing yourself to get pregnant, so that there are different agents which I have put forth, of course, here, that there is turmeric, ginger, vitamin C, as madam mentioned. We have lots of types of gurgles. These are also substances which exist in our everyday food and also in our traditional medication. But apart from that, vitamins and minerals are extremely important to bring about the balance between the free radicals, which actually cause the oxidative stress, and the antioxidants, which are actually balancing the oxidative stress. This is extremely important. Also, consuming good amount of fish, flaxseed, which has good oils. So the good fats which we talk about are also super essential in keeping the inflammation and oxidative stress down. I keep reiterating about it. Of course, which I mentioned, your antioxidants and prenatal vitamins include A, B, C, D, E. Vitamin B has a great role in hormones, balancing the hormones basically. They are existing in whole grains, pulses, leafy vegetables, and vitamin B also, synergistically, so as you can actually have a good supplementation of that. It's most women are seen to be devoid of this vitamin, and also D right now. So there are several of these vitamins which are the prenatal vitamins, which give a good beneficial antioxidant effect. Also, there are some specific effects vitamins have in women suffering with PCOS. We have spoken about them at length in our PCOS sessions. Zinc, selenium, vitamin E, these are actually extremely important as well. Also, apart from that, including good amount of fruits and vegetables in our daily foods is very, very important. Um, and towards the end, I want to emphasize on this, that because everyone's talking about being healthy, fit, losing weight, everyone wants to do a fashionable diet, and try to stay away from fashionable diets. Instead of that, actually go ahead with a personalized nutrition. And like ma'am said, fitness is also extremely important. It's not important just because you're trying to avoid your miscarriage, but it's going to go through for you through a long way, as you will be also taking care of your offspring. So a personalized nutrition and fitness plan from a nutrition expert who works with a good scientific evidence is extremely important, and focusing on reversing insulin resistance if it is there, lowering androgen levels, lowering inflammation and oxidative stress, improving your mood, and improving energy levels. I keep stressing on these points because I think these primarily play a very important role when it comes to, uh, you know, taking care of your pregnancy, and of course avoiding miscarriages. So ma'am, I think we really had a very holistic presentation today. I'm just going to take a quick look if we have any questions that have come onto our Facebook. And bear with me again because I've been having some issues with my uh, well, there is one of these questions, which of course, ma'am, you did address, that, one of this patient is inquiring if she had she did have two miscarriages, and this question had come even the last time. And the patient says that one of them was in the first first trimester, and the second, of course, was in the second one. What are there any specific caveats that you would actually advise to this patient?
Yeah,
I think you went over a very detailed one actually, so
yeah. Basically, as I mentioned that PCOS itself has a multifold metabolic abnormality, which is responsible for causing this. But then we have to also look at various other factors, like sometimes B12 deficiency can give rise to certain problems, or your weight itself can give rise to certain problems. There can be some karyotypical genetical abnormalities in the baby, and infections and all these things also are known to secondarily cause shortening of the cervical mouth opening, which can cause miscarriages, so that your womb is not able to take it up, and then the doctor may suggest giving you certain hormonal supplements or taking a stitch on your womb. All these are extremely difficult, please believe me, as a gynecologist, are very, very challenging situations. On one side you want the patient to continue with the pregnancy, on the other side there are a lot of issues that are happening inside her, and in the middle of both these things actually is the patient's anxiety, and which is naturally so, because they are going to be anxious. But many times, nearly about 70% of the anxiety comes with a lot of ignorance, because they feel that everything can happen and it's easy. But as I told you, that these are very, very complex processes, and therefore we require to look into them carefully. Yeah.
One other question is also from an age standpoint, is it does age really affect? Because these days, and of course I also had that question, because I think a lot of pregnancies happen post 30 these days, because nuclear families and women want to work. uh, could that be a major issue, or does that really make a difference? Because or is it just a notion? Vis-a-vis, of course, we having a 30 plus year old woman, and that's a second question really. A 30 plus year old woman who's fit, fine, everything, vis-a-vis someone who is less than 30 but not keeping fit and obese and things like that. So is there a real difference between the percentage with age?
See, age definitely causes aging of oocytes faster, because ovary is studied and has a reserve potential of functioning normally only for a particular timeline. But having said that, you will have, even if a younger age woman has a lot of abnormal lifestyle and issues, like very high insulin resistance, very high sugar levels, even she is at risk of miscarriages. While you will have an older woman, we have women at the age of 40, 42 coming to us conceiving and carrying those pregnancies normally because they are healthy. They are not having any other issues. So therefore, age has been identified to be a very common factor. But aging process can be, something which can be definitely modified. And currently, if you look at, usually I think out of all the human populations, Korean population is trying to work towards anti-aging measures in which they want people not to age at all.
Yeah.
No aging. And then they want not to live for 100 years, but they want to live for 300 years. They
Yeah.
don't want to.
Well, then I don't think we need to worry about miscarriages, because that will take care of everything, that you yourself are not going to get older. So,
You don't want to make
but
any children and you want to enjoy your own life
yes,
for
exactly.
300 years.
100 years, 300 years. We can imagine how interesting and boring it can be. But yeah. But really, I mean, apart from that, of course, because you mentioned Korea, I was just going to ask you that also. Is it also the whether the different populations all over the world,
Diet.
is there?
My dear child, diet. You
Yeah.
have all the role to play.
Yes.
You go to even
I
a
evidently
country
know
like
that, and yeah.
Indonesia, look at their diet. Awesome diet.
Yes.
The way they take their diet habits, everyday diet itself is so very wonderful to take.
Right.
Our diets are terrible.
Correct. And I can't agree more. But there are so many good things in our diet, and even if we decide to follow all the good things and make it a lifestyle, make it an attitude, I think most things can really change. And it is not a fast process. It isn't a slow process either. It's a continuous process. If people
Absolutely.
follow it, it'll make a huge
So
difference.
many
So
times people do go on those detox diets and they feel so healthy after coming back. That is the purpose. Ek din mein,
yeah,
even if you take one vegetable smoothie, don't you feel nice?
yeah, of course, yeah. And that can really be made interesting. So you can put in things that you like, and if you don't like something, it can always be replaced. But one another thing which I wanted to address out here is, normally whenever there are miscarriages, I think most of the blame of course goes to the woman. So dealing with the kind of stress that is going around, I think is a major concern. Is there any specific, of course, this isn't completely medical advice, but what do you normally suggest to your patients? Because I think that is another stigma kind of a thing that exists, and already there's so much of anxiety around that this affects things mentally.
Yeah, medical advice, as I told you, that we have to be following you may find it very boring that the doctor keeps on doing your tests again and again, keeps on
Yeah,
giving you medicines again and again, keeps on asking you about your diet, keeps on telling you to correct diet, keeps on telling you to lose weight. But unfortunately, that is the only solution.
yeah.
That is, and there is nothing new about it. Only thing is that, yes, maybe we can put you in some such site of a targeted thing where there'll be somebody who will be monitoring your exercise, somebody who will be monitoring your diet, somebody who will giving you peace of mind, and then they charge you. Everything comes at cost. Nothing comes, there are no free lunches. But then just if you decide to take upon yourself with the little guidance of your doctor who is telling you, you will be able to achieve the same results. There are so many patients who have lost weight and become pregnant without anything.
Great. So I think really women have to understand that of course while you're pointing while people are pointing one finger towards you, they are pointing those four towards them as well. But we have to understand that we have to make a lifestyle change in ourselves. And ma'am is reiteratedly saying that medications also have to be taken very, very consistently. But major lifestyle change is extremely important. And I would also reiterate that not only from your own perspective, but as in the beginning, Dr. Wag said that this isn't a change that we are making only towards ourselves, but to our generations that are going to come and their future generations that are going to come. Because it has been extensively observed that insulin resistance is something which is going on for generations. So do understand that refocusing back again on PCOS. PCOS is something which we are going to transfer from us to our next offspring. So we really need to work on it, on eradicating it. And don't forget that Dr. Wag and I are on that mission to actually take away PCOS from the lives of women. And ma'am, we have to, this was yet another very, very holistic input from your end. Your slides were extremely, in depth, and a lot of learnings every time for me as well, and a lot of thought provocation every time I go through your presentations. So it was a lovely evening again, a lovely Wednesday spent with you, and I'm sure, and like you said, of course, I have also been getting those inputs that your presentations are so completely holistic, and women enjoy listening to it. And of course, some of them keep sending me messages over WhatsApp, and which we appreciate that if they don't want to put it in the public domain, but keep sending us your questions, and our numbers and lines are always open for you to reach me, and of course reach Dr. Girija for any assistance that is needed. Thank you, viewers, for a patient listening, and of course being here to encourage us every time. Dr. Wag, it is always a super pleasure to be with you. If you want to end the session, yeah, I think you've already wished everyone a good Janmashtami. That's a good way to really end this session. And we will be back with a next session next Wednesday, another interesting topic. Thank you, everyone. Goodbye.
Thank you. Goodbye. Bye.